Welcome to Doctor of Medicine, where we provide essential medical information to keep you informed and healthy. Today, we'll explore dermovate cream, a potent topical treatment used to manage various severe skin conditions. Dermovate cream contains clobetasol propionate, a highly potent corticosteroid. It is primarily prescribed for its strong anti-inflammatory and immunosuppressive properties, effectively treating conditions like eczema, psoriasis, and lichen planus. Dermovate is used when other corticosteroids fail to control inflammation and itching. Common indications include chronic plaque psoriasis, severe atopic dermatitis, and lichen planus. Remember to apply it as directed by your healthcare provider, typically once or twice daily. Clobetasol propionate works by reducing the production of inflammatory substances like prostaglandins and leukotrienes. This alleviates symptoms such as swelling, redness, and itching. Due to its potency, dermovate is intended for short-term use to minimize risks. Potential side effects include skin thinning, stretch marks, and increased hair growth in treated areas. Extended use may lead to more serious effects, such as adrenal suppression. Always adhere strictly to the prescribed usage to avoid these risks. Before using dermovate, disclose any other medications or health conditions to your healthcare provider. Avoid applying it to sensitive areas like the face, groin, or underarms unless specifically advised. Dermovate is generally not recommended for children under 12 unless prescribed. In conclusion, dermovate cream is an effective treatment for severe skin conditions when used appropriately. Always follow your healthcare provider's instructions and remain vigilant for potential side effects. For any concerns, consult your doctor or pharmacist. Thank you for watching. Please like, share, and subscribe to our channel for more medical insights. Until next time, take care and stay informed.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.